Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 84th episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie Betts, and I am diving into a question that I've been getting a lot lately, so I thought that I would dedicate an entire podcast episode to it, and that is, what are the differences and similarities, perhaps, between a healthy diet for kidney stones as well as kidney disease? Because there are definitely a lot of similarities, but definitely a lot of differences between the types of things that we think about for both of these conditions. And I know that many of you out there are managing both kidney disease as well as kidney stones at the same time. Plus, of course, oftentimes a lot of other health conditions such as diabetes, hypertension, heart disease, bowel disease, and that sort of thing. So certainly not going to dive into all of that today. That is way beyond the scope of just one podcast episode. But I did really want to highlight the similarities and differences from a general standpoint when it comes to kidney disease and kidney stones. And I did want to also quickly comment on, if you have kidney stones, do you automatically have kidney disease? And I think that if you asked every nephrologist in the country or in the world if this is true or not, you'd probably get different answers. But the doctors that I've worked with would say that yes, because you have kidney stones, you could probably be given the diagnosis of kidney disease. And I don't want to say that to scare you, but just to kind of put it into context, because I know I get that question a lot too. So it kind of fit into this episode. But when we talk about kidney disease, there are many, many different stages. There's 5 specifically, not many. There's specifically 5 stages of chronic kidney disease. And all of that, your stage is based on your glomerular filtration rate, or GFR. You should see your GFR on pretty much any blood work that even your primary care physician is doing. That GFR is essentially a measure of how well your kidneys are working. So stage 1 kidney disease is a GFR of 90 milliliters per minute or more, which essentially means that your kidneys are working perfectly fine. There's no reduction in kidney function. They're working just fine, but there's something else going on that would qualify you as having CKD or chronic kidney disease. And again, I know some doctors would say that having kidney stones would qualify you for that. But I don't want you to panic, because chances are most of you out there that are listening to this right now that have kidney stones have a GFR that's completely fine. So even if you do argue that you have chronic kidney disease, you have a perfectly functioning kidney. Again, I don't say this to alarm you, but I do want to kind of mention it, because I think that it kind of drives home the importance of thinking about diet from a whole kidney health standpoint, if that makes sense, right? Like, I think there's so much talk about what I can do to prevent stones, and obviously that is critically important. That's what, this entire podcast is about, essentially. However, I think that thinking about it from a whole kidney health standpoint is important as well, and so that's why it's important to do all the things that we want to do to help prevent chronic kidney disease or help slow the progression of kidney disease. So yeah, hopefully that makes sense, and hopefully that helps kind of put this episode into a little bit of context. But okay, let's dive into the similarities and differences. The other big disclaimer I do have to give before I get into the nitty-gritty is that nutrition for kidney disease is different for every single person with chronic kidney disease, just like nutrition for kidney stone prevention is different for every single person with kidney stones. For chronic kidney disease, nutrition is going to be very, very different based on the stage of CKD you have. So I mentioned before that there's 5 stages. The greater the stage, the more severe the disease is, the worse off your kidney function is. Whereas stage 5, eventually your kidney function is so low that you need either a dialysis or transplant potentially. And so we're going to be looking at the stage that your CKD is when it comes to determining what the best nutrition plan is for you. We're also going to be looking at your blood work. So for kidney disease, we look a lot at things like your CO2 level to determine if you have acidosis or not, or also your potassium level, your phosphorus level, your calcium level, your PTH level. There's all sorts of different things that we look at, vitamin D, all sorts of different labs that a dietitian would be looking at to come up with the nutrition plan that is the best for you. So obviously there's no one kidney disease diet. It is very, very, very individualized based on all of those different factors. For kidney stones, obviously the biggest thing that we look at for truly effective kidney stone prevention is looking at that 24-hour urine test. Without a 24-hour urine test, we really have no idea why you could potentially form stones in the future, and therefore have no idea what we can do to prevent them, other than potentially drink more water, I suppose. And so when you are trying to manage both of these conditions, it's so critical to be looking at these specific lab values to come up with what makes sense for you. I actually have a really great blog post. I will link to it in the show notes of this episode, that kind of details what a quote renal diet is. Renal is just a fancy medical word for kidney, by the way. So it really is like, what is a renal diet? And I kind of outline, we're going to look at potassium. We're going to be looking at your 24-hour urine test. We're going to be looking at sodium and protein and all these different things. So I think that can be a really, really helpful blog post for anyone who is listening to this podcast episode that is interested in this topic of what is the difference or similarities between nutrition for kidney disease and kidney stones. Okay, so now getting into the nitty-gritty of the similarities, because I think there are, at a very high level, there's a lot of the same stuff going on for what we talk about in terms of helping to slow the progression of chronic kidney disease and help manage the common symptoms and side effects of CKD, as well as kidney stone prevention. The first thing that comes to mind is protein. Now, there's certainly different amounts of protein that we recommend for CKD and kidney stones, but in general, we definitely want to avoid large amounts of protein for both conditions, especially large amounts of animal protein. For stones, we kind of put dairy into a different category, but for CKD, we don't. For CKD, we really say that generally focusing on more plant protein and limiting all types of animal protein generally is a good thing. There is a big difference in how much. So for more advanced levels of chronic kidney disease, those higher stages, specifically 3B through 5, before starting dialysis, we would recommend a much lower protein amount than for kidney stones. For kidney stones, we actually don't recommend a low protein diet. We actually just recommend not eating more protein than you need, which most of us in the United States are doing, especially if you are a meat eater. But for some people with chronic kidney disease, we do actually recommend a low protein diet. So, but again, that depends on your labs and if you are stable enough and you're not at risk of malnutrition and these other things, that a low protein diet would be appropriate for you. But in either case, for both conditions, again, we're looking at not eating a ton of protein and definitely focusing on those plant proteins, because in both conditions, eating more protein from whole food plant sources like beans, nuts, seeds, lentils, whole grains, tofu, all of these foods generally are associated with massively improved outcomes. So fewer kidney stones and slower progression of chronic kidney disease. The other obvious similarity is sodium, right? So pretty much for any kidney patient across the board, there are, of course, a few exceptions, always are, but generally any kidney patient should be limiting sodium. So the recommendation for both stones and CKD is actually 2,300 milligrams per day of sodium. So that is about 1 teaspoon of sodium for reference, which I think is interesting to think about. However, that does not mean that you have 1 teaspoon of salt to add to your food necessarily, because most of the food that we eat already has some sodium in it, right? Like even, a piece of bread has a fair amount of sodium, or pasta, or even like a glass of milk, or even like broccoli is going to have a little bit of sodium, right? So it's not necessarily that you have a teaspoon to add to your food throughout the whole day, but I do think it kind of helps put it into context. So that low sodium is definitely true for both stones as well as chronic kidney disease. And then I think another big similarity between nutrition for both conditions is that there is generally a focus on plenty fruits, vegetables, whole grains, and those plant proteins. I already talked about those, so I won't talk about that. But in general, eating a more plant-forward diet, so a lot of fruits and vegetables and whole grains, a whole heck of a lot more than what the average intake is in the United States, doing more of that is going to do good things for your kidneys. Again, no matter what we're talking about, whether it's kidney disease or kidney stones. So I think, a good rule of thumb is if you haven't had time to meet with a dietitian yet, and you don't really know exactly what you should be doing, I think focusing on getting in more fruits and vegetables and whole grains is always going to be beneficial for kidney health, or honestly pretty much any health condition, quite frankly. And then the last similarity that really came to mind was limiting added sugar. So this is something that we don't always think about right away, I think, when it comes to our kidneys. However, diabetes, along with hypertension, are the two leading causes of chronic kidney disease in the United States. And so limiting added sugar, especially if you have any sort of insulin resistance or certainly diabetes, that is going to help control your blood sugar. And we know that high blood sugar for long periods of time can definitely damage kidneys. And also can cause kidney stones as well, or is associated with more kidney stones. So, so those are the big things. I think for the similarities, we've got lower protein and really that focus on plant proteins, definitely the low sodium thing, or really, it's again, not really low sodium. It's just like not a ton of sodium. So with that goal of about 2,300 milligrams of sodium per day, definitely that focus on plenty of fruits, vegetables, and whole grains, along with limiting added sugar. So when all of you kind of put all of this together, it really comes down to like a general healthy diet that most of us should be eating anyway. Like, there definitely is more of a focus on fruits, vegetables, and plant proteins than sort of the dietary guidelines for Americans or the general nutrition advice for healthy eating for the general population. But in either way, like just trying to really focus on a diet full of mostly minimally processed plant foods. Again, those fruits, vegetables, whole grains, and plant proteins, nuts, seeds, beans, lentils, nuts, seeds, tofu, edamame, all of those like whole food, plant food protein options, really has consistently in study after study after study found to be beneficial for your kidneys no matter what you're talking about. There are two diets that I talk about quite a bit. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, as well as the Mediterranean style diet. These are both officially defined dietary patterns that have been studied in both kidney stones as well as chronic kidney disease and found that they are good for both of those conditions. So I think thinking about, if you want to Google, and I'll put a link below to what the DASH diet is as well as the Mediterranean diet, so you can kind of get a feel. But both of these diets are just really, really focused on those plant foods, right? Just turns out eating fruits and vegetables, whole grains, not a ton of meat, not a ton of sugar and added salt is good for our kidneys. So those are the similarities. Now, kind of diving into the differences, and this is getting pretty nitpicky. So it's hard to give this information in a general sense because, again, it's so different for each person depending on your labs. But that big difference, and I hinted at this already, is that how low protein should be for you is going to be very, very different generally for people with chronic kidney disease and kidney stones. Again, for chronic kidney disease, if you have stage 3B or greater, 3B through 5, we would recommend a lower protein diet than what is recommended for general health. So I'm not even going to throw out numbers because it's so individualized. But that is definitely a good question to ask your kidney dietitian, how much protein exactly is right for you. And for kidney disease, it is generally lower than what we talk about for kidney stones. The other huge difference is really a focus on calcium and specifically dairy. In the kidney stone world, I talk about calcium and dairy quite a bit because that calcium is so important to reduce how much oxalate gets absorbed from the healthy foods that you're hopefully eating, to ultimately reduce how much oxalate gets to your urine and isn't there to cause stones, right? So in kidney stone world, I talk a lot about, again, that calcium and really the best source, if possible, in my book, is to get in that calcium is dairy. Obviously, there are tons of people who avoid dairy for a gajillion different reasons, and that's completely fine. I will link to the blog post where I talk about all the different options. But in general, I do talk about dairy as just a quick, easy, surefire way to get in that dairy. We also know that dairy is consistently associated with a lower risk of kidney stones. People who eat more dairy have fewer stones. In fact, there's a great study, a landmark study, if you will, that was published in the New England Journal of Medicine that found that people who consumed dairy or people who consumed adequate calcium, that alone reduced their risk of stones by about 50% over 5 years. So that is huge. So that, the importance of eating enough calcium, and if you consume it, dairy is, again, just a great way to get in that calcium, is so strong. So that's why I do talk about dairy all the time. However, if you have chronic kidney disease, those advanced stages, right? Like I just mentioned that everyone with stones potentially could technically have a CKD diagnosis. But if you have advanced chronic kidney disease, so we'll say again that stage 3B through 5, so that's a GFR of 45 or less, dairy might not be the best option for you, probably is not the best option for you because there's quite a bit of phosphorus in dairy. And for kidney stones, especially if you have calcium phosphate stones, do not worry, the phosphorus in milk is not a concern. But if you have chronic kidney disease, there's just a lot of phosphorus in that dairy and also a lot of protein, honestly, that is adding to that protein total. And that milk protein in chronic kidney disease could be harmful, whereas it just isn't going to do the same negative things that meat protein is going to do for stones. So yeah, that dairy is kind of a gray area. That phosphorus is really a concern once chronic kidney disease, or if chronic kidney disease progresses to those later stages. And so if that's you, I think it's really important to work with your dietitian if you have stones, right? And you have a advanced chronic kidney disease. I think it is really important to work with your dietitian to see where your urine oxalate is falling, how your calcium levels are in your blood, as well as PTH levels and vitamin D, and sort of this whole, this big picture of what's going on to figure out how much calcium exactly is right for you. Because my general advice to eat that 1,000 to 1,200 milligrams of calcium per day with meals for calcium oxalate stones may not be appropriate for you if you have advanced chronic kidney disease. Another big difference is fluid. So for kidney stones, obviously, kidney stone prevention 101 is drinking a lot of water. And that is true actually for kidney health in general. If you get dehydrated, you are putting your kidneys at risk. You can definitely damage, sometimes even permanently damage your kidneys by being dehydrated. And for stones, we obviously want to be drinking a ton. But the recommendation of how much fluid you should be drinking, which is, by the way, enough fluid to produce at least 2.5 liters of urine output per day. That's the recommendation for stones. That is a super high fluid intake. That is, if you have been trying to do that for a while, you probably know that is a lot of fluid. And it's a lot more than what the average person without kidney stones might need to consume. And it's definitely a lot more than what someone with chronic kidney disease needs to consume, right? That's like way, way above and beyond what we need for just like adequate hydration. We're sort of putting you in an overhydrated state, if you will, a little bit, if you have kidney stones, because we want to dilute your urine to prevent stones. But that just simply isn't necessary if you have chronic kidney disease. I think it's important to drink enough water, but you don't necessarily need to be drinking that much water. And then, of course, if CKD progresses to stage 5, say, or sometimes even stage 4 or dialysis, then sometimes there's actually fluid restrictions because your kidneys aren't able to make urine and they're not able to get rid of that extra water. So a lot of times in the very advanced stages of chronic kidney disease, we need to limit how much fluid someone is consuming. So that's obviously the exact opposite of what we talk about for stones. However, I will say that for most people with chronic kidney disease, even up through stage 4 CKD or so, people are able to drink freely, and hydration is really the key, not so much the limiting fluid side of things. But of course, everyone is different. So we always need to talk to your doctor and your dietitian who's familiar with your labs and your situation to know what is best for you. And the last huge difference between nutrition for CKD and kidney stones is phosphorus and potassium. Phosphorus and potassium are two minerals that we talk a ton about in chronic kidney disease and not so much kidney stones. Phosphorus, I could talk for a long time on phosphorus, but the phosphorus that we are concerned about when it comes to CKD is really phosphorus that has been added to a lot of different ultra-processed foods. If you go online right now and look at foods high in phosphorus, you're going to find whole grains, nuts, seeds, beans. These are not foods that we're concerned about because the phosphorus that's in those types of foods isn't very well absorbed. Our bodies only absorb somewhere between 30 to 50% of that phosphorus, but phosphorus that's in those ultra-processed foods is like nearly 100% of that phosphorus gets absorbed, as well as those foods tend to not be very health promoting, right? Like I'm certainly all for having chips once in a while. Obviously, I'm definitely an all foods fit dietitian, but obviously most of our diet probably shouldn't be chips and other ultra-processed foods, if you will. And so it's really the phosphorus that has been added to our food that becomes a problem in chronic kidney disease and can perhaps worsen chronic kidney disease as well as contribute to some unfortunate side effects such as bone disease and heart disease and these types of things. So that none of that really matters for people with kidney stones. Obviously, again, like eating a ton of ultra-processed foods isn't going to be great for people with stones for other reasons, primarily because it's probably going to have a lot of salt and sugar. But when we think about phosphorus specifically, I don't really care, honestly, how much phosphorus people with kidney stones are consuming in the same way that I do for chronic kidney disease. The last big difference between nutrition for kidney stones and chronic kidney disease is potassium. So for chronic kidney disease, historically, we always or often said that patients should consume less potassium. And we primarily did that through restricting lots of, quote, high potassium fruits and vegetables. That is pretty outdated, and we definitely should not be doing that anymore. We actually are most concerned about potassium that is, again, in those ultra-processed foods because the potassium that is in those foods has been added by manufacturers for a wide variety of reasons that are totally valid, but just not the best for your kidneys. That potassium is very, very bioavailable. There tends to be a lot there. And so that potassium tends to be a much greater concern for people with chronic kidney disease because their kidneys can't get rid of that potassium necessarily. And it might lead to high levels of potassium in their blood, which can do all sorts of very scary things in our body. Whereas on the flip side, for kidney stones, we actually talk about eating more potassium specifically from fruits and vegetables. Obviously, eating lots of potassium from ultra-processed foods is not going to be great, again, because those ultra-processed foods are going to have a lot of other not great stuff in them generally. But eating a lot of potassium is actually a good thing for kidney stones, primarily because it helps balance our acid levels essentially in our urine as well as in our body. So I won't go into that today, but generally eating a lot of potassium from all fruits and vegetables is going to be a great thing for kidney stones, whereas it might need to be maybe lowered potentially, but really we're thinking about potassium from ultra-processed foods anyway, but potentially you might need to be mindful of how much potassium you're eating from all foods depending on your labs and depending on your stage again. I will say that in the earlier stages of chronic kidney disease, eating a higher potassium diet is definitely a good thing because we know that when we eat a lot of potassium, that can actually help control our blood pressure, which is key to help slow the progression of chronic kidney disease. So potassium is a tricky one, but the exact amount and types of potassium that are right for you are going to be very different if you have a CKD versus kidney stones and your stage of CKD and all these other things. So that's the last really, really big difference. So again, kind of summing up those differences really is the protein thing. And like, again, CKD might have slightly lower protein than what we'd recommend for kidney stones. There's also this very big difference in how we might think about dairy if you have more advanced stages of chronic kidney disease, those fluid differences. And again, thinking about these micronutrients a little bit differently for phosphorus and potassium. These things are generally a concern for kidney disease, whereas not so much for kidney stones, other than trying to get in a lot of potassium for the prevention of kidney stones from all fruits and vegetables. So hopefully this episode was helpful. There's a ton of information in here, and I know that it's kind of very general, and it's tough because, again, the nutrition for both CKD and kidney stones is so different for every single person. There is no kidney stone diet. There is no CKD diet. It's all so different based on your stage of disease, your labs, as well as your other chronic, any other health conditions that you might have, right? If you also have diabetes, that's going to change things. If you also have Crohn's disease, that's going to change things. If you also have hypertension or, I don't know, any other medical diabetes, right? Whatever, any of these other health conditions, all of these things are going to influence what diet is right for you. And so it's so hard to kind of give these recommendations at this general level. And also the other thing that is super critical to think about is what foods you like to eat, what foods you have access to, what foods you're able to cook. Like all of these things are so critical to be giving any sort of nutrition information or nutrition advice. You're working with a dietitian is really the only way, quite frankly, to come up with a plan that makes sense for you based on all of these things. When you work with a registered dietitian, they are going to assess all of the things that I just talked about and more, honestly. They're going to ask you what foods you like to eat because dietitians are never about just giving you a meal plan. It is actually very common for a dietitian to cringe and like miss a heartbeat when we get asked to like, can you just give me a meal plan? Because we can't, because we don't know what you're eating. We don't know what foods you like to eat. Sure, we can give you a meal plan and you can follow that for like 3 days. And then you're going to go back to what you were doing before because you need to learn how to modify what you're doing now to make this a sustainable change. So dietitians are all about teaching you how to change what you're already eating to improve your health, whether it be for CKD or stones or diabetes or whatever it is, right? And we're also all about helping you eat your favorite foods. Like we are not the food police. We are not here to take things away from you. We are here to help you build a healthy meal pattern that includes all of the foods that you love to eat. Because after all, what is life without enjoying your favorite foods, right? And truly all of them can fit. So I also wanted to mention that it is never too early to start working with a dietitian for either stones or chronic kidney disease. I feel like, unfortunately, in CKD world, oftentimes patients aren't referred to see a dietitian in worst case scenario until they start dialysis. But most of the time I find that doctors don't refer patients to see dietitians until they're in later stages. And it's like, okay, well, we start to see some abnormalities on your labs that are maybe nutrition related, like then we'll send you to a dietitian. But I want you to know that you can and should work with a dietitian if you're interested as early as possible in the CKD process. There's actually data that shows that the earlier that you start working with a dietitian when you have CKD, the longer the time to start dialysis is. So we can literally help you slow the need for dialysis or transplant, actually slow the progression of chronic kidney disease, which is pretty cool. So do not take no for an answer. Even if you don't get a referral, you can go work with dietitians online. I actually have a list of dietitians who work one-to-one with patients with chronic kidney disease, because I only have dietitians that work for patients with kidney stones as of right now, at least. So you can work with a dietitian. It's never too early. If you're interested, there are things that you can do to slow the progression of chronic kidney disease. And similarly, with kidney stones, it's never too early to start working with a dietitian for kidney stones. So what? You only had one stone. The bad news is that you have about a 75% risk of forming another stone at some point in your life, which is pretty darn high. And I can guarantee that there are things that we can do from a nutrition standpoint to help lower that 75% number, right? Which I imagine that most people with kidney disease, kidney stones are pretty interested in doing. So even if you've had just one stone is certainly too many, but even if it's just one stone, it is never too early to start working with a dietitian. Just like CKD, I hear all the time, people say that, oh, my doctor says I don't need a dietitian because I've only had one stone, or they're going to wait until I have 3 and then that's when they refer me. And like, that's just silly. Why wait? One stone is too many. Like I'm sure we would have preferred to not have that second and third stone. Why wait? You can always work with a dietitian. There are things you can do. So with that, I will end this episode of the Eat Away Kidney Stones podcast. I hope that you enjoyed it as always. If you have questions that you would like me to answer on the podcast, I am always all ears. If you head to kidneystonepodcast.com, you can submit your question for a chance to get answered on the podcast, which is always fun. As I always say, I love listener question episodes because I know then that I'm answering questions that you guys have. So with that, I'll end this episode. I look forward to seeing you next week and have a good one.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.